Well, it's hard to describe Desiree, but you guys that are here know her with her many hats and many colors. So I'm just going to say a couple of things. First, Desiree is part of the infectious disease faculty, and she helps all of you take care of the sickest kids in our hospital with infectious diseases. But she also is an scientist, an expert epidemiologist, internationally known with many, many accolades throughout the world. And um, she studies how mosquito-borne viruses distribute, infect, um, harm our children and other vulnerable populations. And then she does something about it. And the problem with Desiree is that she can't stop there because she finds the causes for all kinds of problems, and then she goes further. So I just want to read you her title so that you know that she's not just part of my division. She's also a professor in the Department of Epidemiology and Population Health and in the Department of Environmental Social Science at Stanford Doerr School of Sustainability. She's a senior fellow in the Woods Institute, and she's also the Associate Dean of Global Health at Stanford. And she also trains a lot of new epidemiologists to deal with these problems. She's going to talk today about plastics. And you might wonder, well, what does that have to do with infectious diseases? So I don't know what she's going to say, but I'm going to tell you a little story in 1 minute that is what I remember the first connection I heard from Desiree about plastics. And she was in Kenya studying how all of these these viruses like chikungunya, Zika, dengue, get transmitted by these mosquitoes that bite you during the day, so you can't protect yourself with nets at night. And they end up making little pools of eggs in water in containers that are mostly man-made through garbage. And they were mapping this and decided, okay, let's do something about it. So she organized 250 children from the community and had them collect literally a ton of garbage and remove it to remove these breeding sites for the mosquitoes. And she realized that these breeding sites were made out of plastic mostly, which never degraded. And so they're going to be there forever. And she turned them into pots for trees, and they planted 4,000 trees. So this is the kind of stuff that Desiree does throughout the world. And so I'll let her tell us about what, the impact of plastics on health have to do with you and your children and how we can respond to this threat.
It's really my pleasure to be here and talk to you about something I hate, which is plastic pollution. And as Manuel just mentioned, I'm actually hopeful that this is going to be really useful for your patients, but also for yourselves and your families, pretty much everyone that you love. So this is the map of the day today. We're going to talk about the plastic crisis. We'll talk about macroplastic impacts on health and microplastic impacts on health, some co-benefits and solutions. I'll bring you to Kenya, where I work, and talk about sort of the transformative power of relationships and partnerships and getting your hands dirty on the ground. And then I'll end with some policy updates. So today we're gonna understand human and planetary health impacts of plastic pollution. So I'll teach you about the impacts of plastic on human health, but then also on the health of the planet. We'll examine risk specifically to children's health as much as I can talk to you about early development to long-term well-being. And then we'll explore some nature-based solutions for the plastic crisis, including some work we're doing in Kenya with the black soldier fly farm that's funded through the Human and Planetary Health Center here at Stanford. And then finally, we'll end with policy and partnership. And I'll talk a little bit about international policy and then California policy. So as all of you in the room know, we have a crisis on our hands. Right now, every year, 430 million tons of plastic is produced. Of course, this never biodegrades, so it just accumulates on our beautiful planet. To date, more than 9 billion tons of plastic has been made. And unfortunately, about 40% of that is single-use plastics we don't really even need in the world. Now, I was recently in London, And I was at the little children's area, and this is what you see. You know, you see the little sad trash can landfill, and then the happy trash can for plastic because it's just going to be recycled into something else. We know this is a total lie, a total lie. Less than 10% of the world's plastic is actually ever recycled into something else. And now only less than 21% of plastic today that's made is actually recyclable at all. And when it gets recycled, right, it's maybe recycled once, right? And then it ends up in the sad trash can. As I mentioned, more than 9 billion tons of plastic has been manufactured. That's more than a ton for every single person on Earth. You think about that. More than 1 million plastic water bottles are sold every minute. Please don't buy them. Please, when you see them, get upset with the people who bought them. Tell them we don't need to do this. I'll talk sometimes about why we do still have to do this and the inequities in water in the world, but we really should try to not use single-use plastic. For every person on the planet, there's 21,000 pieces of plastic floating in the ocean. This is what it looks like, right? This is the Great Pacific Garbage Patch or Garbage Island. It's more like trash soup. And 14 million tons of plastic escapes into the ocean every year, and 11 million sits on the ocean floor. And studies have suggested now that around 40% of the ocean surface is covered in plastic. When I started this, like maybe about 10 years ago, it was 25%. So it's getting worse and worse. And if you ever wondered, like, where are these garbage patches? They're in our backyard. So right off the coast of California, between California and Hawaii, is the largest one. Even our beautiful Arctic, right, has plastic in it. The Arctic seems so pristine, so far away, right, so glorious. And instead, there's plastic in the Arctic, and it's being polluted, right? Plastic pollution is generated because of us in our households, traffic, agriculture, wastewater treatment, landfills, illegal dumping, industry, shipyards, tourism, ships, all the fisheries and offshore industry. And then it gets transported to and within the Arctic via the atmosphere, rivers, ocean currents, sea ice, and the eroding permafrost. And then the plastic concentrates in the sea ice and on the plastic, well, I said the plastic floor, but the sea floor, which is quickly becoming a plastic floor. Now, it always shocks me that this is like actually like a relatively recent problem, right? Plastics only became widespread in use in household use in the mid 1950s, right? This is a Life magazine cover just celebrating the dawn of disposable living, right? And it's true, we're humans and we love our convenience, right? Plastic is integrated into everything, and you'll hear about it today, but everything we do. And we've gotten quite used to it. It's quite ubiquitous. And there are some companies making a lot of money off of this. So everyone knows plastic is an oil product, right? It's made from oil. And American companies pump 13 million barrels of oil each day on average, making us the largest crude oil producer in the world with a $14 billion subsidy and tax breaks up to $2 million a year. And we all know, you know, people are buying more electric cars, demand for gas is going down, right? So demand for plastic is going, well, not demand, but supply of plastic will increase, right? Because they want to continue making money. Right now, only about 12% of oil goes into plastic. And the US actually generates more plastic waste per capita than any country in the world, now nearly 40 million tons per year. And this comes from all sorts of industries, right? Again, plastic is ubiquitous. It's in our packaging, our products, vehicles, textiles, construction, you know, medicine, which I'll talk about, right? Global plastics production generated about 2 billion tons of greenhouse gases. It's estimated that plastic production is about 5% of overall greenhouse gas emissions. And it leads to all these macroplastics entering the terrestrial and aquatic environment, right? 22 million tons of it, and another 6 million tons as microplastic. The other thing about plastic is, and you'll hear about this today when we talk about the health impacts, it's not just plastic, right? It's the stuff that's in the plastic. It's the toxins and the additives that are put into the plastic to give it, you know, that's amazing qualities, right? Plastic is an amazing product, plastic, the greater plastic. But we know that there are about more than 16,000 chemicals in plastic, and we have tested some of them, and we know that 25% of them are hazardous to human health. Of those toxins. But there's another 66% that haven't been tested, right? So there's a lot we don't know about what we're ingesting and breathing in. Studies show that humans ingest about a credit card of plastic per week. And then now a recent study just published earlier this year says that we have the equivalent of about a plastic spoon worth by weight in our brains, accumulating in our brains. And this study is actually really interesting. It was published in Nature Medicine just recently. And what they did was, they looked at autopsy specimens of livers and kidneys. And you can see here just the concentration of microplastics in polyethylene, which is a common component found. And what they found in liver and kidney has been found in other parts of the body, the testis and all of this. But the brain had the most plastic of all. And what is shocking is that, or not shocking, but sad is that, from specimens collected in 2024 compared to 2016, all the body parts had more plastic in them, right? Because we're using more and more plastic in our daily lives. So what about plastic generation in healthcare? Well, we know that about 2 million tons per year of plastic waste is generated by what we do, right? And that's in the US alone. And it's true because as plastics have been discovered, we have done a very good job of integrating this amazing material, right, into almost everything we do in medicine now. So there's these impacts, general buckets of plastics, macroplastics impact on health. I've talked a little bit about the ocean. So literally plastic is choking the oceans and choking the marine food chains in the oceans, which a lot of humans in the world depend on for their protein source in their lives. So this is really a food security issue for humans, along with a biodiversity crisis issue. I mentioned that plastics have toxins in them, which I'll talk a little bit about, which can be harmful to our bodies. But plastics also are hydrophobic. And when they're floating in the water, they actually attract hydrophobic pollutants that then come and adhere to the outside of the plastic. So you get the toxins on the inside of the plastic and on the outside of the plastic when you use your table salt. Most of the plastic in the world is burned, right? Where I work in sub-Saharan Africa, about 75% of plastic is burned because there's not adequate waste management. And so this, of course, releases all those toxins into the air, and that helps to contribute to the 9 million deaths from air pollution in the world. And then finally, as Manuel mentioned, so I'm an arbovirologist, I study mosquito-borne viruses, and it turns out that the bad girl there, Aedes aegypti, which is the one that spreads dengue and chikungunya and Zika and yellow fever, she prefers to breed in man-made plastic containers. And so plastic laying around in trash becomes breeding grounds for these emerging infectious diseases. And there's actually a chance that plastic could contribute to our next zoonotic, pandemic or epidemic, because, pathogens enter the environment in all sorts of ways, right? And then if there's plastic laying there, right, these organisms adhere to the plastic, right? Pathogens love to encounter plastic and kind of join on to the plastosphere. And so this, when I'm on service in Lucille Packard, this is what I do most of my days on the general ID service. I deal with organisms that are stuck to plastic in our children and their CLABSIs, right? And so what happens is these pathogens stick to the plastic, interact with other wildlife or domestic animals, and then come back to us. And so it's another cycle of a way that we can have organisms cycling for us. Not to mention, we also disturb the environment in all sorts of ways, which can lead to human health and, of course, zoonotic disease transfer like deforestation and biodiversity loss. But there's a chance that, this cycle could be an important one for future infectious diseases that are important to humans. And we know this is, of course, important for bacteria, but I can tell you now there's even work being done at our Center for Human and Planetary Health on schistosomiasis and plastic, because it turns out snails also like to hang out and just relax on the plastic that's floating in the lakes in West Africa. And plastic is covered in these snails that then go on to spread schistosomiasis and be that intermediate host. We know that, of course, our soil is contaminated with plastic, through industry runoff or through atmospheric deposition. The soil gets contaminated. And then animals and humans that are working with that soil pick up those microplastics and they get back to the humans. And then the crops that are grown in this soil, of course, absorb the microplastics. And then we can actually eat the microplastics that were taken up from soil contamination in those vegetables. And so when I just want to talk a little bit about size, because size really matters, and you hear a lot, right? I talk about macroplastics, which is like 5 to 50 centimeters. That's important for me because this is what breeds my mosquitoes, right? But when we're talking about human health, we worry not just about macroplastics, like I've mentioned, but also microplastics. And the issue with plastic is that it just stays out in the environment. And although it doesn't biodegrade, it degrades and it breaks down into smaller and smaller and smaller pieces, right? And anything under a micro, like a micron or a micrometer is considered a nanoplastic. And those tiny little nanoplastics, why they're so important is they're itty bitty. And so when you inhale them, they go all the way into the deepest airways, into your alveoli, and then even breach that barrier and go into your vessels, right? And when we talk about all the bad things that plastics do to cells, you'll recognize you just don't want this stuff in your endothelium. Also, we inhale about 130 microplastics a day, but I've seen estimates from that to 40,000, right? So it depends on where you live. The more polluted the air you're in, the more you're going to inhale. Okay, so we have a conundrum here because we're really trying to understand what are the impacts on health, right? But there's this system. So we eat all of this plastic, we drink it, we're exposed to it, we inhale it, right? And then there's different types of plastic. They have different contaminants in them. They have different shapes, right? There's fibers, there's little pieces, these different shapes. They also have different charges. So that's important when they're, getting attached to other pollutants in the atmosphere that they're in, right? And then there's just different polymers of plastic, which do different things, right? So the polymers have impacts. The toxins that are adhered to the plastic have impacts. The toxins that are inside the plastic have impacts. And even the size, charge, and the shape of the plastic can have impacts. A fiber, your body may deal with that differently than a little jagged edged thing in your vessel. And so these things then lodge in us, right? They go into our tissues, which I'll talk about today, different tissues. And then we have to try to monitor them, right? And how are we going to monitor them? Some of those studies I'll talk about today, like the one I just mentioned about the brain, liver, that came from tissues, from cadavers, or from autopsy specimens. Some, we can also monitor microplastics and nanoplastics and things like that in humans that are alive by taking their blood or their urine. And so we'll talk about some of these things today. But how do we actually measure these things, right? Well, I can tell you, it is not simple. It is not easy, and it's very expensive. There are many different ways to measure. You can do optical microscopy because some of these things you can actually see under a light microscope, the bigger microplastics, right? But of course, you're not going to be able to see very fine things or tell what type of plastic that is. So there's all these different types of spectroscopy that you can use in order to understand the composition of the plastic. But these things are expensive. It's really complex analysis. It's not available everywhere. And so it's tricky. Each study uses sort of a slightly different system or many different systems just to validate the microplastics they're finding. But there definitely isn't an exact perfect way to measure these microplastics in the humans. And so that is one of the things that we need more research for. Okay, so where have we found plastics in the body? Well, everywhere. I can tell you that, the cardiovascular system, digestive, endocrine, urinary, reproductive, lungs, skin, of course, right? And again, the way we get these plastics is we inhale them, we ingest them, or they're on our skin. They come in through skin, through cosmetics, where microplastics are added to them to make them sparkly, or sometimes we get the toxins from clothes we're wearing, flame retardants, and we'll leach the toxins, and the plastics will leach into our skin. Also, of course, these things have been detected in our secretions and excretions: saliva, breast milk, semen, stool, sputum, and urine. And so they're pretty much omnipresent in organ systems. In the brain, microplastics, particularly polyethylene terephthalate, have been found in human brain tissue. A recent study in Nature Medicine this year shows that, the plastic spoon, but then also association with some neurologic conditions. Again, in lung tissue, we found lots of plastic. That makes sense. We inhale it. In blood, microplastics have been found in 77% of human blood samples, again, with polymers or styrene being the most common. Skin, again, plastics are found on the skin and we put it on our skin, and it can cause skin inflammation and breach the skin barrier. And then the placenta, right? We're pediatricians. We care a lot about early child development. And a study detected microplastics in 100% of placental samples in maternal, fetal, and amniochorial membranes. And so, this is really sad, right? Because now children in the world are born pre-polluted. We find microplastics in the placenta, we find them in the fetal tissue, and we even find them in meconium, right? So our kids are coming pre-polluted. And so what does this actually mean? What are the plastics doing, right? Well, a lot of cellular work and animal studies have shown at the cellular level, exposure to micro and nanoplastics can lead to all sorts of health effects through everything you don't want happening in your cells. So oxidative stress, inflammation, immune dysfunction, altered biochemical and energy metabolism, impaired cell proliferation, disrupted microbial metabolic pathways, abnormal organ development, and carcinogenesis. Pretty much everything that can go awry in our body has been associated with microplastics. And if you look, this was a great review. Pick your favorite organ system. But what I'll just show you on this slide in general is that there's a lot of reactive oxygen species that are happening. There's a lot of disrupted metabolic pathways, some carcinogenesis. For the endocrine system, definitely aberrant hormone signaling and so forth. And so all the different systems have been impacted from these microplastics. But again, this is all associative data because you can imagine how hard this is, right? Plastics are ubiquitous. You're not going to find a control group that doesn't have plastic exposure, right? Not in our world today. And so it's really difficult. You can't do a randomized controlled trial on plastics and see what the outcomes are, right? So a lot of the data is really associative. But there are more and more data coming out that have a little bit more a little bit more causality to them. And one of the ones I wanted to bring up with you is a recent study that was published last year in the New England Journal of Medicine from Marfella, which is an Italian group, where they took 306 folks, 18 years and up, so not children, but 18 years and up who were coming in for asymptomatic cardiac endarterectomy, right? So people, they have blockage, 70%, at least 70% blockage. They're coming in to get their caths. And what they did was they, did the cath, took out the plaque, and then measured whether or not the plaque had microplastics in it. And then followed folks up to about 3 years to see if they were going to have any stroke, heart attack, or death in those 3 years. And it turns out that the people who had microplastics in their plaques had a 4.5 times risk of having one of those end events, right? And they found, the plastics in, the carotid artery samples. They found plastics in aortas. They found it in coronary artery, with atherosclerotic plaques and without. And you can see here the different types of plastic. PET plastic, which is that single-use water bottle plastic, was the most common at 74%. But there were other types of plastic that were found. And this is what it looked like in the vessels. That's just a scanning transmission electron microgram of the plastics. You can see that's inside a microphage on the left side. And you can just see those little jagged pieces, right? Nothing in your body makes little jagged pieces like that. Outside the macrophage and then in the vessels themselves. And then here's the hazard ratio where you can see that in the yellow are the patients who had plastics in their plaque, and the blue is patients without plastic in their plaque, and then them having either, again, heart attack, stroke, or death. And so 4.5 times the risk. Plastics, there's also been recent data about plastics and the impact on inflammation and reproductive health. We know that microplastics contribute to chronic inflammation, and that can lead to infertility and complications during pregnancy. We know that a lot of the toxins that are in plastics, like BPA in particular, are endocrine disruptors and can disrupt hormonal regulation. And that affects fertility and egg quality and sperm count, and that there's, again, widespread exposure, right? We find microplastics in breast milk and placentas, and then in the fetuses and the newborns, we can find it in all of their systems, right? The reproductive, GI, brain, heart, liver, and their immune cells. So in particular, I feel like children are vulnerable to plastic harms even more than adults, just because of what they are and how they are and their biology, right? So children breathe fat, they breathe at more rapid rates, they eat more per like body weight. And so they're getting more plastic just proportionally from breathing faster and from eating bigger, compared to what their body weights are. The other thing is children absorb more pollutants, like relative to their size than adults do, and they're less able to actually eliminate pollutants, right? Because they have a less ability to do so. And the way that we eliminate these plastics is mainly urine, stool, and sweat. Also, especially in early childhood and especially in fetal life, organs are developing, right? So you can imagine exposure to these things early on in life when there's organ development can be really important. And if there is a problem that actually develops because of the plastic, then it's like a lifelong problem, right? Compared to an adult that then gets an exposure and has a shortened life. The children are going to have to deal with these lifelong consequences their entire life. And again, where are they getting the exposure? It's placental transfer, through breast milk, and then also in outer life, right? Children are exposed to plastic everywhere in the world, from their initial pediatric visits, right, to their disposable diapers, to the baby bottles that are all plastic, the little breast milk plastic baggies. I mean, continually, right? It just goes and goes and goes, all the way to like the playgrounds that have like chopped up tires for cushioning, and right there, I mean, they are constantly exposed to plastics. Now, there was a really great, and anybody who's really interested in this, I highly recommend you read the UNICEF Generation Plastic. So this is actually a UNICEF article and compilation and review that was just all about children and their exposure to plastic and what we should be worried about. And in this article, I'm not going through all of these papers, but this is the general figure, just showing that studies have documented these negative health effects, right? Again, many of these are associative, and some of it is the plastic and some of it is the toxins in the plastic, like the endocrine disruptors and so forth. But definitely studies have associated plastic and the toxins in plastic with a lot of birth and infancy harms, including miscarriage, preterm birth, increased BMI, childhood cancers, low IQ, ADHD in girls, allergic rhinitis, a lot of allergies and inflammation, and then childhood exposures, lower IQ, of course, vector-borne diseases like we've talked about, blood pressure, even insulin resistance, and increased weight circumference. So there's a lot of associative data, particularly in children, about plastics, their toxins, and child health harms. And so in this article, they talk about like, well, what can we do as pediatricians? How can we, or just as parents, and grandparents or aunties, anyone in the world, how can we reduce children's exposure to these plastics? And, these are the things, and I'm going to read them because I think it's important for us. So one is discourage waste burning. Like where I am, again, in sub-Saharan Africa, a lot of waste burns. This is particularly bad, right? We can try to reduce plastic use in children's spaces, limit the food and drinks that they get in plastic, right? Utilize safe food storage practices, which means using something other than plastic to store it in. Particularly avoid heating or freezing plastic. Use safe toys, opt for safer baby products. The issue is, I remember I have 3 sons. My oldest is about to turn 20 next week. And, right early on with him, with the baby bottles, we didn't know about BPA back then, right? So who knows what's going to happen to my son Orion, but I'm going to blame it all on plastic. But the issue is, so now it says no BPA, right? But maybe they put in BPF. The issue is and I'll talk about this, they just, oh, this toxin's been associated with these things. We'll just change a group on the toxin and then put it in. And then it takes years for that toxin to be studied, right? So be careful out there. Just, opt for safer baby products, avoid plastic in cosmetics and clothing. Control dust indoors. Again, all of our polyester, breaks down and then it ends up in our household dust and we breathe it, right? So if we can clean that up, vacuum it up, or use an air purifier if we can afford one, that is a good thing to do, along with ensuring proper ventilation. check product safety as much as we can. Again, we know some of the toxins are bad, but a lot of them we don't know what they do. So, and then washing hands, right? Because children are continually putting everything in their mouth. So make sure the stuff they're putting in their mouth is not plastic, not toxic, and that we're washing their hands, of course, before they eat. So they get less of that. But anyway, there's a lot of really great UNICEF resources. I also just want to bring up that plastic pollution really is an equity issue. Again, adverse effects of plastic and plastic pollution on health, the economy, and really the environment are not evenly distributed in the world or even in California, right? They disproportionately affect poor, disempowered, and marginalized populations, such as workers, racial and ethnic minorities, fence-line communities, indigenous groups, women, and children. The most disadvantaged are the most vulnerable. Globally, there's over 20 million adult and child waste pickers, and I'll talk about waste picking a little bit when I talk about the Kenya part. And some of these kids are as young as 5 years old, and pregnant women getting exposed to these toxins, e-waste toxins, and just other plastic toxins. We know that families living near fossil fuel extraction sites and fence-line communities experience higher rates of childhood cancer and other health harms. And that we know plastic waste predominantly flows from higher income regions that can actually manage their waste, but have high recycling costs, to lower income countries facing higher rates of waste mismanagement and inadequate enforcement. And so that's the thing I want you to think about. When you have that little smiley recycling trash can, you drop something in there, I want you to imagine that plastic water bottle you just used is going to end up somewhere in Africa or Sri Lanka breeding mosquitoes and making children sick, because that's actually what's happening to it. And then finally, those who benefit economically from plastic should really bear their fair share of its currently externalized costs, and that would be big oil. So the dangers of burning plastics, all these toxins, air, and we have to think about this more and more, right? Like our world is on fire with climate change. We have more wildfires across the world than ever before, right? And so with those wildfires, a lot of plastic is burning along with other things, right? And what happens when plastic burns? Well, it releases horrible things like dioxins, which cause respiratory damage, immune suppression, and cancer. PFAS, which is a forever chemical, which accumulates in the body and leads to endocrine disruption, liver damage, and immune system suppression, and then benzene and other toxic chemicals, right, that are linked to lung disease and cancer. So burning plastic is terrible. Let's talk for just a moment about these forever chemicals like PFAS. PFAS chemicals are used because it helps with the pliability and the water repellency of plastics. But they accumulate. This is why they're called forever chemicals. They accumulate in human tissues and they accumulate in the environment. And they're known to be associated with cancer and endocrine disruption, immune system dysfunction, reproductive harm, all of that, infertility. It's all linked to PFAS. And you can see here's a map of PFAS. The whole world is contaminated with PFAS, right? Wherever you look, you find it in water, soil, food, right? We found it in our, of course, human bloodstream and tissues. And sadly, more than 2/3 of marine mammals in recent studies have microplastics and these forever chemicals in their bodies, right? So we're toxifying our planet for every living being on it, the plants, the animals, and us. So I've talked a little bit today about the publications in plastics, some ones that I think you should know about, but I'm just here to show you, this is my PubMed search of plastic and health. Last year, there were more than 11,000 publications in this. Clearly haven't read all of those, but it's a burgeoning field. There's a lot of work going on, and there's a lot more work that needs to happen. And the next slide has so many words on it, but it's what needs to happen. Okay, so prepare yourself. I'm going to read them to you. So you can just sit back, close your eyes. So what do we need to do? Like all this research is happening, but what's the research that we really need to move this field forward, right? What do we need to know? We need to know a lot more, right? So first, a lot of toxicological studies, right? We need to understand these effects of plastic and focus on inflammation and endocrine disruption. We need standardized methods actually for defining and measuring microplastics in biological specimens. That's a real problem right now. Also another problem is all the different types of plastics and all the different types of toxins that are in the plastic. There's so much diversity. So we need to really expand the research beyond polystyrene and really examine all of these associated chemicals and try and link them to health risks. Exposure pathways, we still need work on that. How are humans and other creatures being exposed? What the long-term risks are. This is very difficult to do. Environmental pathways, what's happening with our gut microbiome? How are the plastics accumulating in our bodies, right? How are they getting out of our bodies? How do we decrease? Does it just stay? I mean, clearly, if we're eating a credit card of plastic a week, we're getting rid of it somehow. Otherwise, we'd all be plastic by now, right? So we're releasing it, but how can we do more of that? How can we improve our body's ability to get rid of these toxins in this plastic? Focus on vulnerable populations, again, psychological impacts and mental health impacts, policy and public health guidelines, the biodegradables, there's all these replacements now. Oh, okay, don't use your plastic. You want your convenience human? Sure, you can have it. Use this special, looks like plastic, but is a biocompostable cup. What happens with those things? Are they just as bad as plastic? We don't know, right? We need to know before we make that switch. And then also the other organisms, right? We need to research actually nature-based solutions, because my dad used to always tell me, honey, everywhere on Earth, there's a cure to all the ailments on Earth, right? And I'm going to talk to you a little bit about organisms that can actually eat plastic, and maybe that's one nature-based solution to help us with this crisis. So I'm just going to move in our last little bit here and talk about Kenya. So I've been working in Kenya for 20 years. In Kenya and many parts of the world, solid waste is poorly managed. And again, there's more and more humans in the world, and they're using more and more plastic. We know it doesn't biodegrade, and less than 10% of the world's plastic is actually recycled, right? Our research, as Manuel said, I was interested in figuring out why kids in Kenya were sick with fever. That brought me to mosquitoes and mosquito-borne viruses, which brought me to plastic pollution, because it turns out Aedes aegypti is breeding in the plastic waste. And so we've done a lot of work in humans and then also in vectors to show that these piles of plastic is where we actually find the highest numbers and highest abundance of these vectors. And the piles of trash are really close to human dwellings, and up to 50% of people are being exposed to these viruses. But I'm an opportunist, right? So if uncollected trash increases disease, cleaning it up might reduce disease, right? And there are models for this, like glass and metal, right? And while you're picking up the trash, you might actually be able to make jobs for folks and actually get at some of those structural determinants of health that are underlying the problem in the first place, which is poverty, right? I would say that it is a vicious cycle of poverty with solid waste accumulation, then breeding these diseases, making people sick, which impoverishes them. And that just continues and continues. But, we can do something, right? We can deal with these breeding grounds. We can deal with the mosquitoes. We can improve people's economic livelihoods, right? And decrease disease at the same time while improving waste management. And so what we're trying to do is really create these circular economies of waste. Now, Manuel mentioned that we started off like really looking at school kids as agents of change and trying to get kids to understand that there was more than just malaria out there in Kenya, and that there were these mosquito-borne viruses that were breeding during the daytime in plastic containers. And we did a big cleanup, as you mentioned, where a ton of plastic waste was picked up by these 250 school kids. And we did try and repurpose as much of the waste as we could, and planted a bunch of trees in the schoolyards and the households. But still, we were left with a ton of plastic waste. And it was either bury it or burn it, right? So we buried a ton of waste, which never feels good. And so then we started thinking, what can we do about this problem? Now, everywhere in the world, people are crafty and clever, right? So although there's no formal recycling in Kenya, there's an informal recycling trade where young children and really the youth will pick up waste, right? And then sell it to a middleman, a yard shop operator, and then that gets sold to other industries that actually turn it into something else. And so we did a trash to treasure project where we worked with that informal recycling trade to sort of grease the wheels of it so that we could pull more and more plastic off the street to get it out of harm's way and out, stopping all of the transmission of all these viruses. And so we did this business incubation approach for these yard shop operators, the ones who have these plastic kind of piles, and improve their business management skills, strengthen relationships with key stakeholders, and provided training on health, safety, and waste sorting practices. And that led to an increase of plastic waste being volume, more money for them, a strong peer network for them, and then significant reductions in Aedes aegypti breeding. But we recognized that there was a lot more to do. There was a lot of stigma in the community around waste. So we needed to create a lot of awareness. We needed to improve waste infrastructure, create a market for second-use products, really enforce the policies that exist. There's actually a lot of policy in Kenya that's very pro-environment and sustainable, but it's not enforced. And then kind of create a recycling culture where one doesn't really exist right now in Kenya. And so in order to do this work, we launched a nonprofit about 3.5 years ago called the Health and Environmental Research Institute in Kenya. And this is a nonprofit that really inspires community education and new research, policy change, and grassroots activism in these environmental health issues, one of which being the pollution crisis. And so we built an educational hub. We're training community members and really actively engaging them and empowering them to change cultural norms and decrease the stigma around waste, and then strengthening relationships with all the key stakeholders, because everybody has a piece to play, a role to play in this, from the government to industry to just community members. We're creating recycling jobs, decreasing these mosquito-borne and trash-related health risks, and hopefully improving trajectories of health for the planet and the communities. And one way that we try to just engage people and do a lot of public outreach and awareness building is I got the Denning Visiting Artist Fund here at Stanford. I highly recommend it for anyone who wants to work with an artist. And I got to work with Brooklyn-based amazing artist Jean Shin. And she came to Kenya, and we built this gigantic sculpture in the middle of our town, which sits on the Indian Ocean coast, out of 8,000 single-use plastic water bottles, to bring awareness to the plastic pollution crisis, the fact that it's impacting the ocean, which that's everybody's daily bread. That's like their lifeline. And then also the underlying crisis here, which is one of safe, reliable access to clean water in the world, right? Because those water bottles don't need to exist, actually. And then closer to home, we also worked with Jean. We came back here and we made another sculpture called Plastic Planet out of our lab waste. So I run a lab. Ezra's here. She's my lab manager there. That's our viral work in the center, and others' viral work at the Biomedical Innovations building, which is where this was housed. And then those are just plastic pipette tip boxes, right? Single-use plastic. And so again, this was to draw attention to the fact that, us in our labs, we think we're improving health, but we're actually causing a lot of harm too. And what can we do about it? So one of the things I think we can do is look to nature, right? So there are some nature-based solutions out there. There's actually organisms in the world that can eat plastic. Again, plastic is oil, right? So there's a lot of biological energy in plastic, but those initial bonds are very hard to break. But there are things that can degrade plastic, like Ideonella sakiensis, which is this amazing bacterium that was found in the dumps of Japan back a few years back. There's also, other types of bacteria and molds and mushrooms and even little critters like mealworms and black soldier fly larvae that can eat plastic, right? So our nonprofit in Kenya, we have a farm where we actually have a black soldier fly farm where we take compostable waste, and these black soldier fly larvae eat the waste, and then they poop, which is fertilizer for the crops, and they get bigger, and they can be harvested and fed to chickens and livestock. They're like the expensive protein component of livestock feed. So you take something that was just going to sit around the dump, breeding disease, releasing methane, and actually bring it into a circular economy of waste and feed people with it and improve our crops, right, with it. And one of the things is black soldier fly larvae also potentially might be able to eat plastic. So we've recently applied for some grants to try and get funding to do this. But what we'd like to do is take the plastic, chop it up, myco-remediate it, which means feed it to the oyster mushrooms and let them work on it for a couple of months, and then feed that to the black soldier fly larvae and continue this cycle, right? Which again would mean that plastic waste and compostable waste was then being funneled into making fertilizer and food for livestock, which becomes food for us in a food scarce region where I've done a lot of work in this area. About 25% of our kids are severely malnourished. So we have a vision, right? A world where plastic pollution is drastically reduced or eliminated, and communities are empowered to safeguard their health and environment for future generations. And I love this quote. by Isabel Allende. I can promise you that women working together, linked, informed, and educated, can bring peace and prosperity to this forsaken planet. It was just International Women's Day. Shout out to all the women out there doing good work. And our farm is completely women-run and women-led. This is the first time women are actually in the waste space in Kenya, and it is causing a huge, incredible ripple effect that I think is going to be a legacy long after the farm stops working. I'll also say that partnerships are absolutely vital for all the work that we need to do to avert this plastic crisis and actually come together and figure out what to do about it. This is Anna Ibarra-Stewart, who's also a dengue epidemiologist who lives in Panama now. But her and I worked with 90 authors from 26 countries of the world to get together to figure out what it is. How can we dream of transformative global health partnerships? What is it that makes a partnership equitable? And so the book is free for all. We got the money to make it open access. So that's the book there. Let me know if you're interested in looking at it. But I really believe that this is the antidote for the current times as the executive orders come across, ruining global health relationships that took decades and decades to really build, to form that trust and that linkages that can be just decimated in seconds. I feel like partnership work in this world and compassion and empathy is what we all need. And that is what this book is about. So what can physicians do? I feel like first and foremost, please recognize that the low cost and convenience of plastics are deceptive and mask significant harms, including environmental and health risks. I'd encourage your patients and their families to reduce their use of plastics, particularly unnecessary single-use items, and educate them on sustainable alternatives. We need to inventory our own and our institutions' use of plastic, identifying areas for reduction and replacement with greener alternatives, implement necessary changes in practice to green our operations, including our clinics, our labs, our operating rooms to minimize plastic reliance and environmental impact, and then advocate for stronger policies that promote sustainable healthcare practices and reduce institutional plastic dependence. And finally, enhance communication with patients about the health risks and the associated plastic exposure and involve them in sustainability efforts. I'll skip over this, but this is just a paper we wrote with, I wrote with a Stanford student a while back, just showing that there's a lot of opportunities to transform the healthcare waste system in infrastructure, operations, policy, and research and partnerships. And I have here Joy and Ezra. So Ezra leads my lab, but Joy is a senior Stanford student in human biology who they are helping to create these toolkits for labs. If you actually have a lab out there, I think the very first thing you can do is actually take a look at what you're doing in your lab and your usage patterns. That's the waste audit toolkit. And then the greening toolkit is a broader toolkit that includes Stanford resources and other ways to green the lab. This is the lab waste. We've done this lab waste audit, and it's important to do it on a regular basis to continue to find sustainable alternatives and compostable alternatives to your waste that you're actually making in your lab. Because again, medical labs are responsible for about 5% of this crisis. This is another work just to say that it's not just about waste too, it's also about water, and it's about energy, and it's about purchasing, right? So there's a lot of things we can do, not just in our own individual labs, but in the bigger labs, the clinical labs, the virology labs, the micro labs that are around, that we can really green up our science. For those of you who hate plastic as much as I do, Amelia is here. She's my partner in crime in all plastic, and we lead a plastic and health working group. That's part of the Center for Human and Planetary Health here at Stanford. We try to find multidisciplinary solutions for the plastic pollution crisis. We have membership from so many different types of people in Stanford. There's health, there's sustainability, there's policy folks, there's engineers, artists. I mean, so many different folks in Stanford and even outside of Stanford. And we meet monthly. If you're interested in joining us, just come talk to us. And more information can be found on that QR code. And then in my last couple of minutes here, I just want to talk about policy really briefly. So there was supposed to be a UN global treaty on plastic. They had 2 years to do it. It was supposed to finish up in Busan at the end of last year. The objective was to protect human health and the environment from plastic pollution, right? And address the supply chain, plastic products, and the chemicals, trying to improve transparency of those chemicals and plastic waste management within producer responsibility being heightened, because we really need a global cap on plastic production. We need single-use plastics to stop as much as we can. And then we need to know what's in our plastic. Like, what horrible things are in our plastic and why are they there and can they not be there? So first, transparency, what's in the plastic, and then take the things that we know kill us out of the plastic. Okay, but sadly, it stalled. So in Busan in December, the plastic treaty stalled. It did not come to fruition. Talks are still ongoing. There will be more work to be done. People who are at this global plastic treaty are part of our working group. It's still moving forward, but unfortunately with the new administration too, there isn't as much push on this as there had been previously. But we really have to minimize toxicity, right? Like reduce and cap plastics production, eliminate single-use plastics, phase out these toxins, ban intentionally added nanoplastics and microplastics to products, require full transparency and full disclosure, and avoid regrettable substitution, like I talked about BPA, BPF, all of that. And then make disposal and recycling plastics safe and prevent incineration. Luckily, we all live in California, thank God, right? So this is like it's like it's like an island of sanity in the world right now. I feel like a little bit where we live. And that's because we have a lot of policy that actually supports protections for us. There's a microbead ban. There's a whole microplastic strategy that included plastic reduction and banning polystyrene in foodware, microplastics in drinking water. There's going to be mandates on washing machines having microfiber filters by 2029. There's SB 54, which is a huge one that requires plastic producers to join a state-approved recycling program. Like they lied to us at the beginning and told us plastic was recyclable when they put those little triangles on the bottom to actually do it. With 25% reduction in single-use plastic, 100% recyclable single-use packaging by 2032, and all these different recycling goals, right? And there's a lawsuit right now against ExxonMobil about them lying to us. And then there's a DEHP ban, which is important because DEHP is in all of our IV bags and our tubing, and it causes cancer. And so, you know, you're giving the kid the chemotherapy drugs through something that causes cancer. It just doesn't seem right. So this harmful plasticizer is going to be mandated to be removed from IV bags by 2030 and by IV tubing 2035. So anyway, to end plastic pollution, it's going to take all of us, right? The people always say reduce, reuse, recycle. Before the reduce, reuse, recycle, there's rethink, right? Do you even like need that thing? Do we really need all this stuff? I don't think most of it. And so we have to deal with the legacy of all the plastic, the 9 billion tons that's here on the planet already, and then try to decrease the amount that's coming at us, and reduce, you know, just all the new business models, financing, like regulations, you know, humans changing their minds about things. And I really believe that personal actions matter. You know, you think it's like a small thing, but what you do actually impacts what your family does and what your friends do. You can talk about it, you know. It's easy now. Like everybody goes to the bag with or goes to the store with their bags, right? There used to be a time when people were like, oh, whatever, I'm not going to carry my own bag into the store. But now it's just like second, you know, people carry their drink cups around now, right? Some years back, we didn't do that, right? Maybe now we need to start carrying our containers around with us. I mean, we've got to change some things, right? Please avoid single-use plastics. Replace the plastic in your lives with what you can. Choose natural fiber clothing. Install microfibers on your washing machines. Properly recycle, support the policies, and then join cleanups. So to conclude, the global plastic crisis harms health, the environment, and ecosystems. Microplastics and toxins from plastic pollution have been linked to inflammation, cardiovascular disease, organ damage, posing serious long-term risks. Children are at particularly high risk for these health harms because of the vulnerabilities of the childhood development. More research is needed to fully understand the impacts of macroplastics and microplastics on health. However, look, we know enough to know it can't be good for us, right? Already, right? And so we need to do something about it. We need to avoid plastics. And I think efforts at all scales are needed to solve this crisis, from individual action to local action, like I mentioned with our nonprofit, to global action with the UN Plastics Treaty. Climate change is our greatest health threat and our greatest opportunity. And I think solutions to climate change, like resolution of the plastic crisis, is really going to require a wide-scale transition away from fossil carbon. And action is no longer an option. And thank you for your attention.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.